Welcome to our webcast, Improving Health Equity, Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Ranya Shannon, who will discuss the health equity resources available at the Physicians Assistant Education Association, known as PAEA. Ranya is PAEA's Equity, Diversity, and Inclusion Program Manager. She is passionate about, she's a passionate advocate for removing barriers for minoritized students and faculty and is dedicated to effectively implementing PAEA's strategic plan to create a diverse, equitable, and inclusive environment for all physician assistants. Welcome, Ranya.
Thanks for having me.
So tell us about the Physician Assistant Education Association.
Sure. So PAEA is the only national organization representing PA educational programs in the US. So at PAEA, we provide services for faculty at our 309 member programs, and we also provide services for applicants, students, and other stakeholders. Our vision is health for all, and our mission is to advance excellence in PA education through leadership, scholarship, equity, and inclusion. And so we seek to accomplish this mission by encouraging and assisting programs to educate competent and compassionate PAs, enhancing programs' capability to recruit and retain well-qualified PA students, and enhancing programs in the selection and development of well-qualified faculty and more.
So you mentioned it was at 309 locations?
309 member programs, yes.
Member programs. And where are those member programs actually located?
So we're located all across the US. We've got programs in the North, the South, the West, the Midwest. Those are our four regions, and they're everywhere.
Oh, wow, that's great. And I'm curious about how many PAs there are in the US. Would you happen to know that?
I'm not sure how many PAs there are in the US right now.
Okay, I imagine it's thousands.
Probably.
Certainly, if you've got 309 programs, they must be turning out a fair amount of people every day.
Definitely. And growing every day. We have new programs every year.
Oh, isn't that fantastic? Yeah, I guess with the shortage of physicians, which I've heard is coming up, probably PAs are going to take a front and center role, I would imagine.
Probably.
So how is PAEA using the free anti-racism module, which was funded by the Josiah Macy Jr. Foundation?
So we were so lucky to have you, Barbara Lewis, record a video for us. And in that video, you detail kind of a breakdown for how our members can best use this content in their classrooms. And so we have sent that out to all 309 of our member programs. They have access to that video that you recorded, and they have a link to the module. So we just sent that out in the beginning of this year, a couple weeks ago. And so we're eager to hear feedback on how our members have been engaging with this content. So we're not sure yet, but we know they have access to it and have access to that wonderful video that you provided.
Oh, thank you so much for doing that. We really appreciate it. And any feedback that you do get, it would be fantastic if we could know about it too.
Of course.
So besides that particular resource, the anti-racism module, which by the way has quite a few sections to it. It actually has 18 sections and 8 curriculum guides, 38 videos, and 30 exercises too. So it's quite comprehensive. But besides that, what other free resources do you have available on the PAEA website?
Yes, so we have a couple free resources. So one of them is our BIPOC faculty development page. So you may know BIPOC stands for Black and Indigenous People of Color. And so this webpage is intended for BIPOC educators to find resources to support their professional growth and really aid in that transition from clinic to classroom. So on the BIPOC faculty development page, you can find a health educator webinar series that was developed by 2 of our members webinars, Professor Andrea McKinnon and Dr. Artina Dawkins. And this is a really interesting four-part series, and it discusses expanding the definition of a healthcare educator, how to hold realistic expectations for your students, the basic principles of learning, learner-centric instruction, and building your network as a new faculty member. We
Well,
also,
that's, go ahead.
um, oh, oh,
Go ahead.
we also have an article series titled EDI in Action. So that's Equity, Diversity, and Inclusion in Action. And in this article series, every article spotlights a different PA program seeing success in anti-racist and inclusive programming. So these articles and these stories not only provide a spotlight and show off all the really cool work that certain PA programs are doing as it relates to anti-racism, but it also can provide a guide or a model for other programs. So they might see what's working at one program and be able to have that inspire them to create a similar program or similar programming at their institution. We
Oh, that's cool.
also, oh,
Okay,
I'm
go ahead.
sorry.
Oh, no, this is fantastic. Yes, please tell me more.
And so then we also offer free webinars all the time. So some of our webinars last year were equity, diversity, and inclusion restrictions in higher education. We've seen a lot of state legislation that has anti-DEI restrictions for higher education. Um, and I'm sure we're going to be seeing some federal legislation coming as well. So we're talking about that. We also did a webinar called Ensuring Inclusive and Accessible PA Education, and that was actually in partnership with the Association on Higher Education and Disability, AHEAD. So we have a partnership with them, and we also did a webinar on caring for deaf and hard of hearing patients. So these are just three of the webinars that we offered last year. We offer new webinars every single year that are free that you can find on the PAEA events webpage.
Okay, that is so comprehensive. Thank you so much for sharing that. So, how long have these resources been available? Do you have any idea?
So our the first one I talked about, the BIPOC faculty development page and the health educator webinar series that exists on that page, that's from 2022. So that's from a couple of years ago. Our EDI in Action, we release an article every single month for the past 2 years. And we've been offering webinars that touch on different EDI topics for a very long time. So some of these are a little bit newer and a lot have been going on for a long time.
Oh, good for you. Good for you. Now, are there any particular resources that are more popular than others, or what would be the most popular resources and tools, would you say?
Definitely. So we have one really popular resource that unfortunately does exist behind our member wall. So you have to be a member of PAEA to access it, but it's called the DEI Toolkit. So Diversity, Equity, and Inclusion Toolkit. And this was developed by a team of volunteers from across all of our member programs. And this toolkit exists to help PA programs. It provides a framework for programs to put their equity, diversity, and inclusion goals into motion. So this might include new policies and procedures such as holistic admissions practices or developing a reimagined educational mission or supporting individuals that are leading recruitment and retention efforts. It's a really comprehensive toolkit that is very popular with our members. And another one of our really popular resources is our Inclusive Excellence Advancement Scholarship. So this is a little bit new. This is from last year. But basically, for all of our members, they can apply to get this scholarship. And this scholarship funds up to $3,000 in expenses for conferences and training courses that may align with DEI or EDI accreditation standards. So unfortunately, those are both for PAEA members, but those are two of our most popular resources.
Oh, that's great. Now, how about plans for the future? Are you planning for any resources that might be coming in the future?
So we have, like I said, we have new webinars that we do every single year that are announced throughout the year. So we're really leaning into our partnership with AHEAD, that Association on Higher Education and Disability. And we're also really going to be leaning into content about student recruitment and retention. So always check out PAEA's events page, and you can find those webinars and you can just register for them completely free. And then usually if you register, we send out the recordings as well. So more content about disability in higher education and student recruitment and retention. And then ad hoc topics. We always have some cool offerings on our events page.
And are those behind the paywall, or
Those are all free.
they're all free, and you don't have to, okay, be a
Yep, you don't have
member?
to be a member. You can just register and attend.
I see. Okay, that's great. So what would you recommend to anyone who might be embarking on a journey to provide health equity resources? You have a lot that you talked about. A lot of them are free. Are they, and not behind a paywall? Are they available to others to use or to perhaps have as a guideline for developing their own?
Definitely. We hope that a lot of the things that we've provided could potentially serve as a guide for other health equity resources. I think one of the most important things that I can recommend to anyone is really committing to an ongoing process. A good resource isn't going to be one and done. It's going to constantly evolve. So maybe that means you have to be willing to readjust or implement improvements based on your data, based on how people are engaging with what you've provided, based on new information as it comes up. In equity, diversity, and inclusion in higher education, things are changing constantly. So making sure that your resource is meeting its intended goals, ask yourself what changes can we implement based on our data, and just commit to this constant evolving process.
So I'm very curious about what you did first, if you can remember, if somebody is going into this project and needs to develop tools, what would be the first step that they would take?
Sure. So really establishing your goals, thinking about what are you trying to accomplish and who are all of your stakeholders, and then moving forth with how can you engage those stakeholders to accomplish your goals. And we love to rely on data as much as possible, make data-driven decisions. So that means maybe conducting if you're, for example, at a PA program, conducting a survey of some sorts, collecting data on what your students' needs are, what your faculty needs are, etc., and then making decisions based on that data that you receive, and being able to provide people with resources that they actually really need. No one wants to spend a lot of time creating something or developing something, and then it ends up not serving the group that you wanted it to serve. So really making sure that you have stakeholders in your development process, and you're constantly checking yourself, relying on your data, and then, like I said, being able to adjust as time goes on.
Oh, that's great advice. Thank you so much for that. And is there anything else that you might want to add to our conversation here as we start to wrap up?
I would just like to thank you for creating the anti-racism module. It really is such an excellent, comprehensive resource. And I'm really excited to see how our member programs engage with it moving forward, and what else you create and what else we can do together.
Oh, thank you so much, Ranya. I really appreciate it.
Thank you.
You've been listening to Ranya Shannon talking about the health equity resources at the Physician Assistant Education Association on our webcast, Improving Health Equity Resources and Solutions. I'm Barbara Lewis. Thank you for listening.